Hello, my name is Basan, and today I will be presenting on the anatomical considerations of vasectomy. First, we will explore the normal anatomy of the male reproductive system, especially the structures relevant to vasectomy. Second, we will walk through the surgical procedure itself, highlighting the anatomical steps and how they preserve function. Finally, we'll discuss post-operative imaging and potential complications, which are very, very rare. This sagittal illustration on this image shows the anatomical regions of the penis. So we have the root, body, and the glans. The root of the penis lies in the perineum and anchors to the inferior pubic rami. The body contains the erectile tissues, which is also called the paired corpora cavernosa dorsally and single corpus spongiosum ventrally, which encases the urethra. The glans is the terminal expansion of the corpus spongiosum and surrounds the external urethral orifice. The reason this orientation is very relevant is because the vas deferens, which are the ductus responsible for transporting sperm, passes deep to this root region as it ascends through the spermatic cord into the pelvic cavity. While the penis itself is not involved in the vasectomy procedure, understanding the spatial relationship to the scrotum and the inguinal canal is essential for the anatomical navigation during the surgery. So let's dive in a little deeper. So we have both images showing the vascular anatomy and the erectile tissue structure. On the left, we see the arterial supply of the penis, the internal pudendal artery, a branch of the internal iliac artery, is the principal vessel. It gives rise to the deep arteries of the penis, which course within the corpora cavernosa, and the bulbourethral arteries, which supply the corpus spongiosum and the urethra. Avoiding these vessels during vasectomy is very important to prevent post-operative hematomas or ischemias. On the right, we see the longitudinal and the cross-sectional view of erectile tissues. The corpora cavernosa are shown in the green and are responsible for generating rigidity during erection. The corpus spongiosum in the yellow surrounds the urethra and remains patent during erection to allow semen expulsion. These erectile structures lie ventral and anterior to the vas deferens and are not directly involved in the vasectomy, but their close proximity reinforces how important precision during scrotal incisions, specifically during vasectomies. Before looking at the surgical process, it's important to first define what a vasectomy is from an anatomical perspective. A vasectomy is a minor surgical procedure that involves cutting into the vas deferens. As I mentioned before, the vas deferens is paired ducts that transport sperm from the epididymis in each testes to the ejaculatory duct, located behind the bladder. By disrupting such pathway, the sperm is prevented from being included into the ejaculate. Now, on the left here, we see the normal anatomy. The sperm is produced in the testes and then mixed with the fluid from the seminal vesicle and the prostate to form the semen. On the right side, after the vasectomy, vas deferens is surgically interrupted either by ligation, cauterization, or application of clips. This stops the sperm transport, but the rest of the system remains functionally intact. Important to mention also that the testosterone production, libido, and erectile function are not affected because the testes and the endocrine pathways remain unaltered. Semen is still produced during ejaculation, just without the sperm. This preserved both physiological function and sexual appearance while we have an effective male sterilization. Following a vasectomy, radiopaque metal clips may be used to occlude each vas deferens. This frontal pelvic X-ray shows bilateral clips located near the base of the scrotum. These serves as markers confirming that a vasectomy was performed bilaterally. From an anatomical standpoint, this imaging helps clinicians recognize prior procedures and avoid unnecessary surgeries. The placement of these clips is very superficial, just above the testes and outside the peritoneal cavity, which aligns with the anatomical safety of a vasectomy as a minimally invasive outpatient procedure. Although vasectomy is a safe and effective procedure, rare complications can occur. One such case is documented by Para and Associates in 1992. A case study that I came across where a 38-year-old male presented with fever, perineal discomfort, and dysuria several weeks following a vasectomy. On figure A, we see an axial CT scan of the pelvis. The bladder in B is clearly visible, and posterior to it is a hypodense region indicating a fluid collection adjacent to the seminal vesicle. This matches the expected location anatomically, which is posterior to the bladder and superior to the prostate. Figure B is a transrectal ultrasound taken in a sagittal plane. The prostate P is visualized anteriorly, and superior to it is a dark hypoechoic area representing the abscess cavity. And this confirms that the fluid is collecting in the anatomical space surrounding the seminal vesicle. Figure C offers a slightly different ultrasound angle, again highlighting the relationship between bladder B and P, the prostate, with the abscess again appearing as a dark, irregular fluid filled area between these structures. This case is a great visual on how retrograde spermatic pressure, potential infections, or poor wound closure may contribute to the abscess formation. Although uncommon, it emphasizes the clinical importance of understanding deep pelvic anatomy, especially the spatial relationship of the seminal vesicle, the bladder, and the rectum to ensure accurate diagnoses and effective intervention in post vasectomy complications. So that was the end of all what I know about vasectomy. As we learned, it targets the vas deferens, a single anatomical structure critical for sperm transport. Its interruption leads to reliable contraception without disrupting testosterone production, libido, or erectile function. Rare complications such as the seminal vesicle abscesses can occur, highlighting the importance of anatomical awareness just beyond surgical site. Altogether, vasectomy is a precise and safe procedure when performed accurately. Hope you learned something new, and here are my citations to dive in deeper.